Hi guys, we are recording our Digital Health Vitals in person again, and I'm super excited to tell us who we have today with us. It's Sergei Polevikov. Hi Sergei.
Hi.
Stephanie Davis.
Hey folks.
And of course, today we have a special guest. Her name is Billy Morgan.
Hey guys.
Can you briefly tell us about yourself for our audience so they know who you are?
I am a medical speech pathologist by trade with a background in tech, health tech, mostly revenue cycle management products. And now I work with Growth Pain and Spine, which is actually the largest pain practice in New York. And we are expanding our practice. And so I am part of all different assets of the practice, including vendor evaluation of all the tech. So pretty plugged into the tech space.
And there's another company you worked for before. Is that right? What was that? Which company was that?
So start with the C.
Well, actually it started with an A, but we're gonna talk about it. That's what I'm asking.
I did work.
They're all over the news. But Stephanie, you promised us to give us a recap of all the outstanding public earnings of second quarter. Is there anything interesting for us?
There's been a bunch of double-digit moves, actually. So there's been a lot of volatility in the space. That's been a function of the space since it's become more of a long-short equity sort of sector. But you saw 2/3 of the sector have double-digit moves on the last print, and you only had 12 names print. Of those, though, usually I'm used to downward volatility in health tech. Surprisingly, we had a lot more upward volatility. 7 of those names actually had those nice double-digit upward moves, and we will go through a few of those.
Let's do it.
I was thinking for the ones that call out, it's the 2 biggest winners and the 2 biggest losers of the earnings season. We will start with the 2 biggest losers.
Can you guess who are the 2 biggest losers?
Or can you look over my shoulder and read my paper?
That's why I'm here to learn. I'm guessing Teladoc, I don't know.
Look, Teladoc had a really rough print. They were down 28%. It was a fine quarter, actually, for the core business. But the big struggle was they had a BetterHelp-driven guidance cut. They cut it by 12 points on revenue growth. So it was pretty meaningful, and it shows that there's not really much of a market left for cash pay. There used to be a really strong cash pay market. I think that's been collapsing for 2 things. One, they ran through a lot of the user base, right? People that are willing to pay out of pocket did. And the second is that there's more and more payers that are reimbursing for behavioral health. So if you could pay for this out of pocket or your insurer can pay for it, most people prefer to not pay money. The big issue with that evaporating cash pay therapy market is that while they're moving more towards the insurance pay product, they don't really have an own doctor construct. So you haven't seen as many of their doctors on the platform able to take insurance. And so they just have a supply-demand mismatch. While peers like Talkspace, which was acquired, they don't have that. They made the switch earlier. So been a struggle. I don't know how they fix it. They can lean into AI models or care navigation or specialty, but at this point, it's a slow turnaround and there's still some gaps in the management team. So we'll see.
Time to do GLP-1.
It's worked for a lot of their peers, right?
Yeah, but those earnings, yes.
Now, the other big loser in this fast earnings season was Health Catalyst, unfortunately. Yeah, surprising, right?
What?
Yeah, so it's had some pretty big moves.
They're like one of the good guys, I thought.
No, they are. They're a great product, but their stock wasn't one of the good guys.
Okay.
So here's the issue. You may have remembered that their stock doubled since April. They had a heroic move, and it's because they sold Vitalware. They sold it for $150 million, and that was more than their market cap. So if you just want to value it on a cash-only basis, it was valuable, so it went up. The issue is when they had their earnings print, they revised their guidance to exclude Vitalware. That was the majority of their profitability. So their first half profitability was at 18 million. Their second half profitability is about nothing. It's break even. So that made folks a little bit more nervous about what the go forward was and explained why Vitalware got such a healthy valuation. That's another one, I don't know how they dig out of it because they need to change the narrative. And I do think they have some pretty tough competitors in the space. I know Innovator used to be more of a direct competitor. They've been kind of grown beyond it, but they've had a lot of successful fundraisers. Their valuation at this point is like a double-digit multiple of the valuation for Health Catalyst. So we shall see how that moves. Enough negativity. I'm not Sergei. Doximity. Up 33% to end the day. At one point, it was up over 100%. I'm a shareholder, so I was a little more excited earlier in the day when it was up like that.
But we all know the reason, right? It's because
short squeeze.
Amit Pool came to our podcast last month.
Oh, is that it? Is that it? Look, I mean, they had a solid beat and raise. They did well in the AI business. There's been a lot of fears about OpenEvidence eating their lunch on the AI side. They've showed that OpenEvidence could be a competitor, but they have enough space in the universe in order to have a healthy level of growth without it. And don't forget, this is a highly shorted stock. This is kind of market dynamics, and that's why being up 100%, up 33 tells you, if you have everyone shorting the stock at once, this is like I think it was high teens short interest. If everyone's then trying to cover, you're gonna have a pretty meaningful stock move. This has always been a volatile asset. This is like the king of the short squeeze, if you will. So we'll see what happens in the future. But I've been a longer term believer in their story.
With your own money.
With my own money. I mean, I vote with my feet, but I couldn't before. So that's why I do it. I'm just a big believer in what they're doing. I think OpenEvidence fears are overblown. I don't know if you have any views on that.
Yeah, I mean, we've had obviously Amit on the show. I think it's a very innovative company. Like no matter what people say about it, competitors come and go, but they always have like little things. Like when they couldn't figure out iPhone, they're like, oh, let's just have that feature where you can call directly on the iPhone. Like, why do we need to use an app? What I was called doc fax or that
the dialer?
No, digital fax when they're saying and now, of course, Epic uses it, which is like another story, but Epic has everything now. But it's, they've been trying to kind of, so I kind of like them. And most importantly, they're making money. They have positive net earnings. So
as you know, you very much value that. Like, here's my view.
As opposed to OpenEvidence and all those other guys. So, yeah.
OpenEvidence is earlier, so I think they will get to profitability. The biggest thing for me is how could you ever imagine someone with that level of profitability and growth would not have true competition, right?
Right.
It'd be bananas to think that. For every competitor, there's their counterpoint. And that brings us to our last stock I'm going to talk about, Amwell. Who would have thought that Amwell would be one of the biggest winners? Well, Teladoc was one of the biggest losers
not
in the
me for
quarter.
sure.
Not Teladoc.
And not me, no, for sure.
Amwell has had its struggles. I will give you that. I would attribute this primarily to their new CFO, COO. And I know you gave me some pushback before we started filming of how much could one person really change the narrative of a story. This is the one person that sets the guidance. And Amwell is starting to beat and raise when from their initial pull out the gate post-IPO, they have consistently been a miss and lower company. And so Mark Hirschhorn, he had a really storied track record at Teladoc, and he has been executing again. Other thing I'll call out, they've got their Defense Health Agency renewal. It's the next big focus item, which will be coming up in the next few weeks. But if they can close that, they are poised to return to mid-teens revenue growth next year. If you compare that to Teladoc, they're projecting down 5% this year. Like, that's a pretty big difference. So the valuation disconnect may not make sense.
But do you know what are they doing differently? I was pushing back. I'm saying, like, one CFO cannot do anything unless there is a moat, there is a growth story. Last time I checked, it's kind of like I didn't honestly see much difference with actually like somebody like Teladoc, where you try maybe to get on payer side, but like how do you differentiate yourself? Like I can get
first mover. Teladoc's always been differentiated by being a first mover in the payer space.
Right.
That was Amwell's big struggle. But what they're doing is they're moving to subscription revenues, which is more of a higher margin recurring business model. So it's better for them as opposed to.
So why would I subscribe to Amwell?
And they're going after government contracts because they already have DHA, so they have some opportunities beyond that.
Oh, I see. Right.
Look at Cerner. Government contracts are about as sticky as you can get. If they can execute on that, that's a huge opportunity for them. Don't forget also Teladoc, their biggest drag is the BetterHelp business. They don't have that over at Amwell.
Right. But they're still net income negative, right? Or Amwell.
So Amwell, what they have the opportunity though, is they have kind of a messy platform structure. There's probably too much of their dollars invested in the platform. I think if you have a good CFO, you can clean that up.
I'm just saying, like, even wherever I go, like, even my, like, what a local provider, they all have telehealth now, sometimes just their own. So it's always like, as a moat, unless you have something like, maybe government contract is a good.
It's channel and contracts. Channel and contracts is always really going to be the differentiator in health tech. And I would say, if you had to really boil it down to, like, does management team make a difference? I know you've argued against that. I would take the counter to that every single time. Mm-hmm. I look at like AstraZeneca versus Bristol in, like, the pharma space. One has one of the best CEOs of all time in pharma, and one has a different culture. And just look at how their stocks are performed. No, I mean, as you know, I've been talking about, like, management on a negative side when there is completely, I should say unethical, but sometimes just the management that doesn't know what it's doing and maybe unexperienced or with previous mistakes. So that, to me, that was a red flag. But you're talking on the positive side that it could also make a difference. So, I can see that. But again, there has to be a company. But you're right. Like, culture should come from leaders, and whenever there's good culture, I think that's to me that's a very positive sign. And don't forget that they guide the investors. That's who they're really interacting with. So if you have a good management team, you know how to manage investor properly, you got a good stock. Right. Although, as you know, public markets could be unforgiving. That's why we kind of like, I'm always like skeptical on private side. I mean, obviously here we're talking public markets, so that's kind of interesting. So this guy, how did he leave Teladoc? What happened? Did he live on his own, or?
Guys, I don't.
No comment. No comment. He is one of the best CFOs in the space. I will not comment on his personal matters.
Billy, do you invest in any health tech stocks in public markets?
I actually, no, I do in tech, but not health tech. I'm so jaded.
That's such a bearish signal.
I'm so jaded by all of it, honestly, at this point. So I'm waiting for, like, the real winner to show up.
Well, let's talk about one private company everybody heard of. Epic had their annual UGM conference this week. Sergei. Yeah, I have to consult my notes because it's just so much going on. But yeah, But is there so much going on? I feel like there was no big announcement like last year. There's actually a lot of announcements, but the problem is, like, nobody knows what's real, what's not, because a lot of things, like Judy is saying, they're kind of like in the works. But if you read, like, through the list and, like, have the list, it's like they're covering, like, everything. They're even going, like, down market this year, which is a relatively new thing. I've never heard of it. Like, they're going into, like, smaller organizations, smaller providers, which has been Epic actually started as an ambulatory play. That's a fun fact. Well, but the common knowledge is that they're kind of like been all this latest time has been going after big players, and especially payers. There are a lot of partnerships there, like with United and Aetna lately. But now, for example, Sonnet, as you know, it's been, I think this is what you're alluding to, kind of like their mini EHR that they would sell to, like, smaller organizations. No. So they always had, you would sell a larger organization an instance of Epic, but then they could resell it to all of the small ambulatory players. So they're one of the bigger EHRs for ambulatory, even though people think of them in all the academic medical centers. Right. So I was talking about Sonnet, which is like a small version of their kind of main EHR system. So they would sell it, I guess, for lower price, but usually to, like, small organizations, maybe independent ones. Apparently, they haven't, like, invested anything in that until this announcement. So they're, like, going and after clients. I mean, it seems like eClinical Works, Athena. Those are typically, like, sometimes even geographically located, definitely not Northeast. And so they're literally trying to, in my opinion, like, when I was kind of like reading through this, I wasn't there, obviously. I did watch some videos, which is kind of funny, of Judy in a cowboy costume. So she's always, like, I guess, trying to come up with themes for these conferences. So this year, as a Halloween enthusiast, I cannot hate on her. Mm-hmm.
This is so funny. But
So wait, you're saying that they announced that they captured all the big companies, all the big health systems, and now they're going after small ones? That's the announcement?
no, that's not the announcement. So the big announcement was, no, it was just kind of like between the lines. So there's a bunch of announcements that actually Judy made. Some of them are kind of like, she's saying, like, for example, Ergo, which is their healthcare intelligent layer, which I guess is pretty new, built around their chart system called ART, which also has ambient AI. So that's relatively new. The irony is that, and I guess we can touch on that as well, that a breach was presented like literally that same morning, and they're saying, oh, we have the CDS system now that's basically going beyond AI scribes, saying we're going to help clinicians kind of in their decision making as well now, which is kind of interesting to me, like when it comes to like things like diagnosis and interpreting results. It's kind of like interesting area. Remember, I asked Shiv, like, are you, what do you think about like FDA approval? Why are you not FDA approved? And he was saying, well, I think he essentially said we don't have to, like nobody, because AScribe essentially transcribes and then assigns like billing codes, so like we don't have to. Now they're actually going after like after the clinical decision-making market.
But clinical decision support doesn't need FDA approval, correct?
Well, if it comes to diagnosis, they have to. But yeah, in general, you don't have to. But the funny thing is that it came right after Ergo, which, from what I'm reading, direct competitor to what Abridge is offering right now, which is kind of interesting. So to me, the question was, when we interviewed Shiv, remember, I was like curious about. We just came from Health, which is actually upcoming soon this year. And the big announcement was that Epic is partnering with Microsoft on their DAX and I guess like old Nuance system. I was reading it as exclusive, but I guess like with Judy, like nothing is exclusive. So she's partnered with everything. Because when I asked Shiv this question, he's like, I'm not worried. We're still partnering with Epic. We're partnering with anybody. We have like a bunch of hospitals who are on Epic. And I'm like,
I don't think it's a question of partnership. I think it's a question of exclusivity when the majority of their base is coming from Epic users.
So that's what I thought. And by the way, I haven't even heard the mention of Microsoft or Nuance at this conference. Maybe I missed it.
But Microsoft wasn't there because they were going to be a big partner. They partnered with Nuance because exactly that reason. Microsoft doesn't care.
And I haven't heard about that since last November.
They're happy to have Epic just be the one front leading it. Yeah. And I think that's why you're seeing a Bridge have to do so much innovation here, because you're becoming more of a direct competitor with an Epic.
At the Epic conference, which is interesting. Anyway, it's like, to me, it's just fascinating that, I guess for Judy, it's like, it doesn't matter. Like, if somebody kind of mentions us and says, hey, look, we're on whatever, my chart or on Epic system, let them present. So I think a Bridge is trying to make this push into clinical decision-making and also clinical AI. I think the assumption is that Epic, even with Microsoft, if you look at history, it always takes time for them to kind of establish it, to deploy the product. So a lot of, like, I was looking at the history, a lot of startups actually made their kind of niche impact in that time until Epic basically said, all right, we have it, we're offering it to clients, and then it's like real competition. So in theory, Epic has everything, and I have like a bunch of products here. I don't know if we should mention it, but like Billing AI, Patient AI, clinical evidence. Obviously, they have partnership with. They have their own system called Cosmos.
But that's their whole thing. Epic releases a bunch of different solutions, and even if it's not the best solution, a lot of hospitals have an Epic first mentality where we already have this, sunk cost issue where we paid so much for Epic, we might as well have as much of the value from Epic as we can. Right. And so you'll see folks that have Bridge, but they also have, Epic's AI as well. That's not uncommon.
Right.
But they will have to choose at some point.
Will they? I mean, a lot of hospitals, people used to say that about telemedicine. And then if you look at it, most hospitals have 2 telemedicine vendors.
Really?
Yeah, fun fact. I used to do that.
I think healthcare is getting more comfortable with like a tech stack. Yeah. It's not just like the EHR anymore. You're able to get people in other spaces.
Yeah, well, if I'm a operator at a health system, why would I use similar products from 2 different vendors and pay for both of
Because
them.
some doctors like one and some doctors like the other, and you're probably paying on a per seat basis.
Yeah, that's the weirdest thing, because, and I think this is what Shiv Rao was kind of alluding to, that he's like, look, we're not concerned, because like we're talking to particular clinicians, particular groups, you know, if they like Epic, they can take Epic. If they like us, so potentially they can have both, which is a little weird to me, but that's why I was looking back at that interview. I was like, and also Heidi, for example, I think they can find their niche because they're more like special. We're talking about dental, which Epic, at least as of now, is not touching. So it's very interesting. What's interesting is that in both Abridge announcements and Epic's, there one clinical evidence company they mentioned was up to date. They never ever anybody mentioned OpenEvidence, which I guess is like such a bummer for, especially given what's happening in the last few weeks with this. We've been talking about OpenEvidence, like complaining about the study that was kind of minimizing their platform versus generalized models, and even their kind of endless fight with Doximity.
So I remember what I said, if you don't play nice in the sandbox, and a lot of other people don't want to work with you.
Right.
I've seen that happen before in the past. Look what happened with Forward.
Yeah.
Becoming that we'll try to mention at every other episode for some reason.
Yeah.
Billy, what did you learn from Epic's announcements? Anything surprised you?
I mean, I think Epic definitely, I think it's a smart strategy for them to start to go down market, because they do own most of the systems, and like you said, it's a really sticky product. So like, and what are you going to switch to? Like Cerner, and that's like Oracle, whatever now. Like,
Oracle Health, yeah.
Yeah, and they're also not really doing a whole lot and having a lot of like internal turmoil. So everyone's going to stay on Epic. And I think it's smart that they're going to these smaller practices, because all of these smaller practices eventually are going to get bought. And all these private equity companies, it makes you look better for a deal to be on Epic than any other EHR.
Wait. What?
So like
all the small practices are going to be bought?
So like if you're, well,
Why does it look better if you're on Epic for a deal?
because it's easier to integrate into the rest of the like MSO structure and the rest of the system. Like if you're
So assuming it's a roll up.
Yeah, which is I think happening all over in healthcare right now. So I think that it's a smart time for Epic to be making this play, because it definitely poises you better when you're trying to sell the company.
Is that a good thing for an industry though?
I mean, I didn't say that.
I mean, I would say it's maybe a good thing for the industry, a bad thing for patients, right?
Patients always pay.
Yeah, and I don't think having monopoly is a good thing for the industry. I mean, which is what Epic has become essentially.
All right, would you argue that for phones as well?
For phones?
Yeah. So Epic dominates about half the space. The iPhone has a very similar level of dominance. Would you say that Apple is bad for the evolution of mobile phones?
I think, honestly, Apple has a little bit rougher experience with the regulators. So I think they understand that if they go too far, if they're, let's say, stop being competitive, stop bringing value to the customer, then the antitrust comes after them. Just what happened with Microsoft in the old days, and actually Apple as well.
But Apple was able to
this
have
doesn't
that
happen with
persist for
Epic.
a
Like
while.
nobody goes after Epic. We have this.
But Apple had a bunch of non-competitive things, right? Remember when you couldn't really group text people on Android, but you could only do that via Apple?
But that's what I'm saying.
That took a while to resolve.
But
Same thing, we're doing interoperability now.
No matter what the administration is, seems like they're going after kind of the same players. So it's like same companies seems to be like on everybody's mind that they're like monopolies, like Meta or Microsoft or Apple. Nobody's talking about Epic for some reason. Like I've never heard like Trump talking about Epic like monopolizing everything. But if you look at numbers,
I feel like everyone's talking about Epic.
I think in certain segments they're even bigger than Microsoft. And again, I'm convinced that they're innovating because of that pressure, because of various. Actually, iPhone has competition. We're talking about if you go into Europe, like what are they using in Europe? A lot of people using Android.
A lot of people use Cerner in Europe after Siemens. I'm
saying that I'm convinced that until we push like real regulatory pressure or any kind of pressure on Epic, they're gonna do what they like to do, which is, maximizing their revenue without much effort. I mean, they have a bunch of announcements, but by the way, when they say features, it's like literally sometimes they're partners. I'm pretty sure like a bridge is gonna be one of their features because like they partner with someone. So if you look at their features, it's not something that they innovated. They partnered with somebody. So it's a lot of sort of, which is kind of ironic because Judy's famously saying we're not sort of acquiring anybody, we're not becoming like part of anybody, but like this partnership is this features, what they call, if you look inside the features, that's essentially what it is. It's adding apps, adding those partnerships, and this is what it is. I don't think there's as much innovation, you're right, as like compared to Apple in other industries, for example. And I think it's because they don't have as much pressure. I think Apple has much more pressure, even with like Trump administration. But again, this is just my personal opinion. I don't know.
I'd take the counter to it. I would say that they've done a ton in order to innovate in the sector. And if you look at being a patient with a practice on Epic versus the alternative, I will take an Epic practice every single time because they had things like MyChart, which were really easy to use, as opposed to, like, what is it, like Oracle Health just rolling out their patient portal now.
Exactly.
Like, thank you for showing up to the party.
Yeah.
I can tell multiple stories about alternatives. Just that if you're an alternative, it's really kind of hard to compete with an elephant in the room. But I know a lot of startups developing their own AI native, by the way, EHR systems. People use it, small organizations use it, not big health organizations, obviously. But I've actually seen demos of them, and actually some of my customers use it, and a lot of them are happy. So it's not the only player out there, and I'm convinced it's not the most innovative one, but again, maybe I'm kind of...
It's never going to be most innovative when it's largest. Mm-hmm. That is the innovator's
That's the game, yeah. As long as you're the largest, yeah, that's what it comes down to. But yeah. So to me, when I was reading about all these features, what Judy calls, to me, like the most exciting one, at least for me personally, is Cosmos, which is this kind of like their analytical platform. They have like, I guess, various types of Cosmos. It's like a big platform. They have this Cosmos Curiosity, Cosmos Research that's coming up apparently last year. So to me, the value, when they really show it in research, in sort of peer-reviewed studies, whatever, that having all this patient data, you can actually kind of predict not only on a personal level certain events happening, but also maybe geographical levels, like before CDC has, because they see all this data, like patient coming in, they don't need names, it could be de-identified.
Oh, so now you're positive on something that has large majority market share.
I'm saying if they, I haven't seen that yet, but at least on paper they have it. So if they can prove that they have this predictive power, actually far before CDC, far before anyone was saying, hey, something's happening in this area, there's this outbreak of something, because they have all the data. So all they have to do is just aggregate it. So I think Cosmos, yeah, so I have to be positive sometimes. So I think on the Cosmos platform, I'm actually positive. So, but we'll see what happens.
Are you positive on Oracle Health?
That's actually what we've been talking about. It's kind of funny that all the announcements come right before the Epic conference. So like literally, I think it's like day one or something, Oracle Health.
Coincidence?
It's coincidence because they're trying to compete. But I've actually talked to a couple of people with this new announcement. The problem is that they're saying it's this new EHR system, but it's not turnkey yet. A lot of these things that they've just announced feels like just to align themselves with Epic, but it's not actually operational. It's a lot of this restructuring going on with the old Cerner system. As you know, they've fired a bunch of people, a lot of restructuring. So it's their kind of, I feel like, poor opportunity to have a dent on this EHR debate, but I feel like they're not there. It's kind of like on the background. That's why nobody's talking about it.
There's just such an afterthought,
it's an
right?
afterthought,
I mean, the problem is if you're Oracle, do I focus my time on OpenAI or Cerner? Mm-hmm. Yeah. Which will do better for my shareholders?
It's actually a good question. I'm not sure because anyway, it's its own discussion, but like with AI, it has its own problems. But yeah, obviously in terms of the effect, the scale, OpenAI is obviously, biggest story. But OpenAI has its own problems, so that's a topic of separate conversation.
Well, 4 hours ago, I was still in Kansas City at the healthtech event organized by Digital Health KC. I think half of the room, maybe even more, of all the people I talked to, former Cerner employees. And it's interesting to hear like how
They're a main employer there, right?
it was, not anymore. And that's why it actually impacts the whole economy of the city, because there is not a large office for Cerner anymore there. And like people are saying that they have no idea where this product is going. Trying to rebuild AI native HR, it sounds great on paper, but I wonder what VA thinks. They still haven't implemented their contract with VA department. And
I'm not convinced that Oracle will be the end owner of Cerner in the next 5 years.
they just sell it?
So you can spin it in a tax advantageous transaction starting next year.
Explain this to regular people.
So when you buy something, you can't just buy it and sell without getting a tax bill. You got to wait a certain amount of time, and then you could do like a tax advantage spin, a spin out, so it could be its own separate company, or then you could do like a spin and sale. There's a bunch of different ways you could get rid of it, but it's too early for them in order to get rid of Cerner now. I just think if you look at how Oracle has evolved over the past 5 or so years, they were kind of looking for more guidance 5 years ago. Healthcare was a bigger thing because of this whole pandemic thing. And they made a bet that maybe hasn't played out as well as they wanted it to. They've also probably done a lot of cross-sales already of Oracle Cloud, OCI, into the Cerner base, in which case you don't necessarily have to own it. But they're making most of their bets in compute right now. So if they're doing that, why have a healthcare distraction?
Good question. Bailey, do you know any health systems that use Cerner as their main HR?
I know a couple, but I did do a demo with Oracle back in December, and it was really interesting actually because they didn't really have a product to show, and they were showing the product that was going to be released over the next couple of months. And that was like the first time I'd ever been on a demo where they're like, we actually don't have this yet, but we're going to be selling it. So I thought that was a little strange. It almost seemed like they didn't even have a product to sell, like something's going on with what they have already. It also sounded like their leadership just kind of wanted to hop on the AI train and get an AI co-pilot that will review the chart. They just wanted to get the AI forefront in there. But I mean, everything that I've been reading, and it seems like they're losing the EHR battle against Epic, which if you asked me 2 years ago, I would have said that they would have gave Epic a run for their money, but I don't feel that way anymore.
I wonder, can Veteran Affairs Department get out of that contract that they signed for?
Very unlikely. Super, super unlikely. I covered Cerner during the win of VA and DoD. The problem is you're really going to have the DoD on one platform, you're going to have the VA on another, you're going to have interoperability issues. That's insane. So you wouldn't have one contract not go with the other. And it was a pretty long vetting process. I think it was a full year and change. So I don't think they're likely to go switch it over.
Yeah, but they haven't delivered. As I know when the contract was signed, but...
Oh, because the government is so concerned about efficiency.
All right, let's talk about Commure. Did you all read the stat investigation?
Yes.
Sergei?
Can I say the only positive thing that's going to happen in this segment because we have you two here?
That's good.
Okay, so there's a lot of kerfuffle about partnership fees, and I get that. We're never supposed to have any sort of referral fees and things like that. But if you look at business models in health tech throughout the ages, there were partnership fees at One Medical. They just charged it more as a PMPM. And every time I misstepped and I said, oh, the referrals that you get, they're like, no, they're not referrals, they're partnerships. But you're partnering on a PMPM basis, that seems like you're getting a referral fee. So it's not unheard of within health tech, even public health tech, to have referral fees. So I think we are maybe blowing this a little bit out of proportion. All right, now go, tell me I'm wrong. It was a third of One Medical's revenue base. It wasn't.
Yeah. See, look, I'm not a lawyer, but I think it's So a little bit goes close to that. It was an anti-kickback law, and that's what they're arguing about.
But 1/3 of One Medical's revenues was not.
I'm not saying it was right. I mean, yeah, it just seems.
And if they can go public and be vetted and all of those things and get bought by Amazon, like if all of those things can happen, and we're not going to go like kickbacks, then why are we doing that now? Besides, it's Commure and it is a punching bag of the sector.
Hold on, I think some of our viewers might not read the article. So can somebody summarize the main point of the investigation?
Yeah, so first of all, I've been looking into Commure, as you guys probably know, for I guess a year now, just based on a lot of conversation with employees, former employees. I wrote a piece. I was approached by Commure, had to take it down, rewrote it. Then it was approached, let's just say approached, they have their own methods. So I just don't like how they operate because all the information is coming from the sources. So they disputed this article. So this article talks about different things, but also about some common things. Like I did mention in my investigation that it's weird where customers are also investors, pretty big ones. And also salespeople, which is the whole point of this referral program, which is basically says...
Also not fully atypical. Look at Premier. Their customers were their biggest owners.
Yeah, I feel like that's like what health tech. I mean, it's all about the partnerships and getting in with a system that will let you forward deploy, engineer, aka like build the plane while you fly it with them. Honestly, I mean I feel like that's so common. I'm the first one to, say something about Commure, but at the same time, like I do feel like all the other companies that are out there in health tech are all leveraging their relationships and partnerships. And
yeah, that's why healthcare has such large boards, because you have so many customers on the boards in non-voting capacity.
Well, I may be wrong, but I think I've seen in this article that I think the DOJ was actually looking into that in this particular case. So in this one case, they mentioned that this physical therapy organization company, they had this contract where basically they had to generate $750K in partnership sales, and if they don't, they're gonna have this what is called referral penalty or something, fee of $60K per year or something. And so I think Stat was, again, a lot of this sort of allegations, so I have to be careful. And obviously, Commure is disputing that, so I'm just kind of like referring what Stat has been saying from kind of like my read of the article.
But Stat said they shut the program down after it came out, right?
They did. I got the email.
Yeah.
I got the email
So yeah,
that the program was over.
Got an email that, it was shut down.
Right after investigation went out?
Before. A couple days before.
It was during, because there's a story there that I found out about the article, and I should have, to my kind of, I should have maybe like partnered with the authors, because I knew about the article coming out back in May, because, Commure, I'm not going to mention names, but their head of sales and partnerships started reaching out to clients. This is how I found out. One of the clients told me, this Commure guy keeps calling everybody saying, this Stat article coming out, it's all not true, but watch out for that. So we knew it's coming out. I didn't know exactly the facts, but and again, it's weird that when I had this essentially a lot of similar evidence, they went hard on me. I'm sure they went hard after Stat, but obviously Stat has a big legal team, and I'm glad it's out there. I think whether it's illegal or not, I think it's something people deserve to know. Clients, patients deserve to know. What's happening, and it's I feel it's just disservice to the industry when they hide these facts, when they're going after people like myself and other journalists. This is just disgrace. And again, there are probably some errors in my article, but you cannot just go so hard with teams of legal people with threats and everything. I feel like this was a bit too much. Again, a lot of sort of alleged facts. I'm not gonna say everything was correct. Even in the Stat article, obviously Commure is disputing. Stat mentioned a lot of that kind of with their conversation with Commure, that they're disputing all of that. But to their credit, they put it out. People need to know. When I was writing about that, again, let's just say it's alleged, but let's just say hypothetically, when a customer is also an investor, this to me, that's clear conflict of interest. You trying to jack up the price because it's good for you as an investor, but as a customer, you're taking that price because, again, you're an investor. So when you're wearing these two hats, it's clear
I think that's like the most common thing in healthcare, so I'm going to disagree with you there.
To me, that's wrong. I mean, I don't care if it's common. This is wrong. Like think about it.
Well, when you decide to run your healthcare business, that involves zero attribution to management team, especially the C-suite, as well as zero customers that are also investors. You let me know how that goes.
I think it's wrong. Commure, I think, is a very kind of illustrative case. It's a big company, General Cattle is Heman's baby, endless money for like nothing to show, in my opinion, not much to show. And also a story about like products without actually being ready yet. That's also a Commure story. Like a lot of people told me that there are demos, and then there are engineers saying, "Are you kidding me? It's like we don't have it. Like what time horizon are you talking about? We need like a year or something to build that." So, I mean, it's a common story, not just Commure, obviously, but that's a lot of the story as well.
Really, were you selling something they didn't develop yet?
No, well, so it's funny because I remember when they started building the EHR and they were trying to get us to sell the EHR, and I was like, I'm not talking about the EHR because you guys are not even done building this yet. Like, I was fine to sell the revenue cycle, but the EHR but again, there's so many companies. I mean, there's so many companies that do things like this now. So I do think Commure is being like made the example, but I'm not saying that what they're doing is like right or wrong, but I do think that they're being made an example out of. But I think that there are surely lots of other companies that are buying hospital systems and then deploying their tech that these board members are investors in. And, I mean, it's all just who in healthcare.
We're a very insular industry.
Yeah.
Look, here's my take on this one. And this is for any founder that is currently watching this program. Don't fight with journalists. You might not like journalists, they might not like you, but you need someone cool on your team that can go and talk to the journalists. They can be the cool friend that gets you into the club and says, no, it's cool, he's with me. You don't want to fight with him because then the article's going to come out and you won't be able to go and make your piece. The best thing you could do is have an article like this come out and say, you know what? I would contest some of those facts, but I'm happy to go and do a separate piece with you or some sort of one-on-one and make some positive organic news flow out of it. This is a great example of how to mishandle your communications.
And here we'll put the contact information. Stephanie Davis, communication strategist, a
I'm
consultant.
not a communication strategist, so don't reach out to me. But God, do not fight with your journalists. No one wins besides maybe Stat because they're going to get a lot of clicks off of this.
Hippocratic AI, another example, which is another General Catalyst company that's kind of...
We only have time to hit on one company.
Yeah. One
next time.
I feel like it's a bit of a miss. We haven't talked about R1 making a pretty big acquisition.
Yes.
Tell us what happened and we'll wrap it up because...
All right, we got only a few minutes. Look, there's been a lot of focus on Ensemble as a big innovator in the revenue cycle management space. And the reality is Ensemble didn't have the burden of being a public company, so they were able to invest in their tech platform now. But you saw R1 make 2 acquisitions now. They acquired Fair, and now they're acquiring Humata, and they're creating this more of an AI native rev cycle, both with coding and with the claim side of things. That's pretty interesting because you look at the history of R1, they were more of an offshoring play, and now they have this R37 Innovation Lab. I don't know what they're doing with it yet. I haven't talked to anyone within the Innovation Lab, but that's going to be a big part of how their story evolves. So something to watch.
I love R1.
And it's also interesting.
Look at us,
bullish on R1.
Bullish.
Yeah.
Look at that.
On R1, super bullish. Yeah.
But also the founder is interesting, right? I don't remember the exact deals, but there was a bunch of deals in there. He sold his initial company to Olive. Then he buys Olive assets for prior authorization for dirt cheap.
I mean, he probably had some of the assets in his company, which was real.
Spins it into, I mean, you got to give it to him. In the meantime, we're still using faxes. I mean, this was the whole idea of sort of automating prior auth, and we still use faxes for some reason.
A lot of folks, though, have bought assets from Olive because Olive had some real businesses in there, and they bought some real businesses, like Waystar bought a big chunk of them. You just had to buy it after Olive was gone, so you didn't also get all the legal burdens that Olive was accompanying with it.
Yeah, and also I must mention this because I mean the time is so fascinating. So Epic also, as you guys know, like just introduced their real-time prior authorization. They're advertising it as sort of first sort of player in this area to comply with this CMS 0057 rule, which is, I guess, Dr. Oz's kind of like transparency in the interoperability rule, coming in effect January 1st, and apparently like nobody's ready. And Epic says, well, we're ready. You know, we're partnering with like United Health and Aetna. And now this announcement of R1 acquiring a prior auth company, which is like AI native, which is kind of interesting, like all kind of coming together. I don't think
they're doing different things. Like I think that Epic is an authorization check, and I think that the latter is actual getting the authorization, going and getting it, and managing the tracking of it and whatnot, which I think is the more valuable of the two. Like Epic's prior auth checker, like I don't really get that, because once you've been working with payers for a long enough time, like you know who needs auth, you know what CPTs need auth, like you don't.
But was it ever?
And where do they get that from?
Was it ever real time? Like you basically like get yes or no. And I'm actually curious. Like
not impressed.
A lot of denials now. Like to me, it's like, well, if you have the same percentage, maybe more of percent of denials, I don't care if it's real time. Actually makes me concerned now. It's like you're getting no like right away. It's like I don't know. Yeah. But it's gonna be interesting. But yeah, the fact that they're making this announcement, Epic does as sort of part of this sort of compliance thing, kind of try and put themselves into this conversation. Hey, you know, we're on top of things. We're actually part of the conversation. We're in Washington D.C. as well. I feel like this is very interesting. We'll see.
Don't forget their different user bases. R1's largely a Cerner shop, while Epic is more ensemble.
Any last second announcements? Any big expectations for September?
I think for health tech, I feel like September tends to be a quiet period besides for IPOs, right? And that's will be the big thing to watch. But if you look at it, you have Epic UGM and then you have health. So there's this little gap in between.
That's why you go into Europe? Because this is going to be a quiet time.
Dr. Francis calling.
Awesome. Well, thank you guys. It was a pleasure, and looking forward to our next episode.
Thank you.
Thanks, guys. Thanks for having me.